Now to answer some of your common medical questions, and joining us live to answer all of them, as always, every Wednesday is News Channel 5's medical specialist, Dr. David Soria. He is, when he's not here, the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks for coming in.
Good to see you.
As always. Our first question for you today relates to that study about arthritis. This viewer wants to know, can rheumatoid arthritis hit younger people, or does it mainly strike older people?
Yeah, rheumatoid arthritis is very, very common, and it can strike at any age. But like most progressive or autoimmune diseases, typically it's going to start a little bit later in life. The most common time is going to be around 30, 40 years old. You can start off with a little stiffness, start to feel some pain in your joints rapidly, and
that
sometimes
early,
not so. You bet,
Okay.
very commonly in the 30s. But it's so slow progressing that it tends to really start to manifest in your 50s and 60s, and that's when you start to see some of the deformity as well. But one point I do want to make, and that is the importance of distinguishing osteoarthritis from rheumatoid arthritis. Rheumatoid arthritis is a progressive disease. It comes with flares, and it's a systemic disease, so it affects your entire body. It typically it affects the joints on both sides of the body and the smaller joints, hands and feet, unlike osteoarthritis, which is one joint,
more
bigger
isolated.
joint, you bet. And osteo hurts as you use the joint. With rheumatoid, it hurts in the morning, and as you use it, it tends to get a little bit better. Reason why that's important is because those are the type of symptoms that your doctor is going to want to know so that he or she can start to treat it appropriately.
Okay. All right. Our next question for you today, this viewer writes, I know stress makes my shoulders tense, but can it also make my back hurt? Is this back pain something more serious?
Yeah, we talk a lot about stress. There's a lot of people that are stressed out, and for good reason.
America is stressed out.
For good reason with what's going on in the world. And no doubt back pain is no exception as far as some of the physical symptoms that can present when you're stressed. The reality, though, is that it presents in a different way, and the most important thing is I don't want you to chalk it up to stress. So the things I want you to look for are, is it there constantly, is it a tension, and is it localized to that area? If it is, and you've had it before, and you've had it checked out, then maybe you can chalk it up to stress, and then we got to look at the things that we need to do to prevent or lessen your stress. But this is when I want you to go see a doctor. If you have a fever, if you're over 50, if it occurs without any inciting trauma whatsoever, if you have pain that radiates down your leg, all right, or other symptoms such as abdominal pain in association with
Then it could be what?
Then it could be other more serious things like your kidneys, like disease with the disc or significant injury to the area. Please get it checked out. Don't chalk it up to stress.
Okay. All right. And our last question for you today. I know that stress... No, let me move on to the next one here. Can your fingernails indicate your health condition?
You know, surprisingly, they can. I mean, just like your eyes to your soul, your fingernails can be to your health. And some of the things we look at, let me give you some examples. If you look at the fingernail bed, if it's white, hey, that can give us an idea that you might have anemia. If it's red, believe it or not, that can tell us that you might have heart disease. If your fingernail itself is white, sometimes that can be a cause or from liver disease. Also, if there's a little bluish, it means you're not getting enough oxygen, and we tend to look for lung disease. Those type of things kind of give us an idea. Also, the texture of the nail can give us an indication as well. So even though it's not real reliable and typically it is a late finding, it's something that we look for.
Sure, maybe something in your next physical to ask your doc to check out.
Absolutely.
All right, some great advice as always. If you have a question for Dr. Soria, you can send it to him through us at WPTV.com. Just click on the health link, scroll down, and on the right-hand side, you'll see a form where you can write him your question.